All right, with cases surging, Governor Greg Abbott has temporarily paused some reopening measures. We know this. That includes suspending elective procedures. Dr. David Winter from Baylor Scott & White Health joins me now. Dr. Winter, boy, what a 24 hours, right? So when we talk about these elective procedures, are we talking colonoscopy? Are we talking, rhinoplasty? What are we talking about here?
Certainly any kind of elective procedure can include a rhinoplasty, artificial hips, artificial knees, hernia repairs. It's a large number of cases that can be in that category. And certainly we are willing to comply with any order or any law that wants to come out at Baylor Scott & White Health. All the hospitals are. We think we have capacity right now, but we're going to try to make sure that everybody understands our top priority is the safety and health of our patients, our employees, and the community.
Yeah, I'm glad you mentioned the employees because I keep hearing about hospital capacity. Like, yeah, there might be beds, but do you have the staff? Do you have the doctors? Do you have the nurses? Do you have the respiratory therapists? Do you have the people who are there and healthy and able to help?
We do right now. As these cases go up, we'll see, but we have plenty right now, I can tell you. The big tragedy, though, is this is definitely going up. It's going the wrong direction. And in the rest of the world, cases are declining. What are we doing different? Well, we're not paying attention to the virus. This is in our control. And so 3 simple things can turn this around. It's very important. Physical distancing, wearing masks, disinfecting, washing your hands. We can turn this thing around. I think it comes up to us individually to turn this around because there's no vaccine, there's no drug right now that's going to work significantly. But it's in our power. We had turned this down before. We're getting out now, socializing more. We need to do that, but we need to do it safely. 3 things to do. If we just distance, wash our hands, and wear a mask, we can turn this situation around.
Yeah, we gotta start in our minds and go from a me society to a we society. We've been saying that for months now. Let me ask you this, because I'm starting to get a lot of text messages from personal friends, people who I'm close with, anywhere from a 1-year-old to, people in their 70s going, I have this now. What do I do? Help, help. You've been covering this for such a long time. So there's nothing really to do except for treat the symptoms if you're positive, right?
That's right. Only about 15% of folks get sick enough to have to go in the hospital. If you're very sick, contact your doctor, go to an urgent care center. For the rest of us, it's stay home and not spread it any farther. We're limited on testing supplies right now. Not everyone can get tested. If you have symptoms, we can get that done, but now there's about a 2 or 3 day delay because of the increase in this surge or this big wave we have. Yeah, we need to be smart about this thing and try to dampen down this spread of this virus because it is taking off. This virus has no affiliation to anybody. This just wants to spread. So we need to fight this virus with all that we have. And it's 3 simple things. So let's get that message out, Sonia. Help me with this, please.
Well, I'm going to try. And yeah, that's really unfortunate, the point you make about testing, because, by the end of this month, the federal government is yanking funding for testing. And so we're going to be caught in a pretty hard place, I have to imagine. Dr. Winter, thank you again for your time. We'll see you soon.